If you have patients that aren't doing well in terms of tolerance, that's your fault. It's you as a provider aren't doing something that you could be doing. So let's own that, let's accept that, and let's change it. So the way we're going to do that is we're going to do one of two things. Remember what I said. So did you guys get all the links to the book? That one didn't work either. My QR codes are just failing everybody today. Treatment should be well tolerated. If your treatments, Morpheus specifically, is not well tolerated, you're not doing something right. So I gave you 2 principles. Help me out. What were the 2 principles? Remind me. If your patients are not doing well, we're going to do one of 2 things. What's the first thing that we can consider doing? Oh, you guys are the best. Decrease your settings. Let's not forget that. That's such an easy thing that I forgot. I didn't even realize when I wanted to cram everyone in a box, get as much energy into the tissues, and then I was having patients with their legs flailing and flopping all over the chair, yeah? Yes, and you're like, hey, sorry. What do we tell our patients? This is so rude, providers in this room. What do you say? Grin and bear it. Beauty's pain. What are all the things we tell everyone? No pain, no gain. That's so mean, right? But that's what we do. So decrease your settings. What does that mean? We may need more treatments. And that's okay. Or maybe you increase your density of treatment. Maybe you do more passes. It's all about energy in the tissues. We don't have to get it all at once. Okay? Or we can, what's the second thing? Yes, you guys are amazing. Increase our level of anesthesia. That's what this lecture is going to be. Again, for clarity's sake, I'm not for a second saying you have to. I'm just saying you could. You don't have to do all the things we're going to talk about. But these are options. The more tools you have in your toolbox, the more successful, I think you're going to be. Okay? So, these are tools in your toolbox. Let's talk about the opportunities. Topical. Okay. Actually, I've got their own slides. Let's go through these one by one. Let's start with the topical. I joked about the blue dot top with my friend over here. Remember that? Where my nurses, it's from the same pharmacy. This is before I met Manatee. It's from the same pharmacy, but I had 2 different lidocaines. I'm like, what the heck? Why does this one work and this one doesn't? And I found out it's from the compounding process. And it's not as good as some. Manatee is fantastic the way it compounds and suspends this lidocaine in suspension. And it leads to more effective topical numbing. So go talk to him out there should you want what I use. Seriously, it's a fantastic compared to likely what you're using. So make sure a couple of principles. I use 23%, 7% lidocaine tetracaine. There's BLT, there's all kinds of form of this. I have not found that to be any more effective than just plain old-fashioned lido and tet. 23, 7%, and then make sure it's plasticized when it's suspended. The reason why is a cream base, just a simple cream, is going to absorb into the skin quickly rather than sit on top of the skin. So anything that is more occlusive is going to be better.